Hi, everyone. We're going to go ahead and get started. Welcome to the 360X Transitions of Care demo. I'm Brett Andreessen, the Standards Advisory Lead in ONC's Office of Technology and the ONC Lead for 360X. We're so excited about all the interest in this demonstration and glad to be able to bring this to you virtually, given this was originally planned for the HIMSS Interoperability Showcase. This project was initiated by ONC back in 2012, originally intended to enhance referral management, and since has been extended to include additional care transitions, such as acute to SNF transfer. 360X referral management is now an IAG-approved profile and will be live in practices for several vendors later this year. 360X for acute to SNF transfer is in the IAG ballot pipeline and will likely be available in several LTPAC EHR systems by the end of 2020. The 360X specification employs proven industry standards only, allowing for a low development bar for EHR vendors. CCDA and other document attachments provide critical, necessary clinical information and can be curated in a patient or diagnosis-specific fashion by the sender. The discrete data in the CCDA allows for semantic interoperability, reducing documentation burden and transcription errors, as the recipient can create a new patient chart from this data or reconcile data with an existing chart. Direct is used for private and secure transport. XDM metadata provides the context of the exchange and can facilitate message routing in the HR recipient system. HL7v2 messages are used to track the transition of care progress and/or gaps in care until the loop is closed. You will see many of these in the demo today, but others include no-show if a patient does not arrive for a scheduled appointment cancel, appointment rescheduled, etc. The 360X profile also requires a unique patient and referral or transfer ID, which persists throughout the process until the loop is closed. The primary goals of 360X via Direct are to enhance communication across care transitions, thereby improving the quality and efficiency of care that is provided, while decreasing provider and staff workload, documentation burden, reducing or eliminating transcription errors altogether, and decreasing the cost of care by preventing unnecessary duplicative care and improving care efficiencies. Now I'll pass things off to Dr. Holly Miller to walk us through the demonstration.
Good afternoon. I'm Dr. Holly Miller, an internist and the Chief Medical Officer of MedAllies. Please keep in mind that what you're about to see is a live demo requiring us all to transition our screens for you to see the various systems involved. The team chose to perform a live demo rather than a recorded so that you can see that all of this is quite real. As a live demo, there are bound to be some glitches, and we ask that you please bear with us and stay with us. Throughout the demo, please enter your questions in the chat or the question box, and we'll address them at the end. Our patient today is Sheryl. She's been living with her daughter, Andrea, since the death of her husband several years ago. Sheryl has hypertension that's been poorly controlled, as she often forgets to take her lisinopril 20 milligrams a day. In the last many months, Andrea has noticed that her mother is even more forgetful than normal. Several times, Sheryl's wandered out of the house and become lost, with neighbors or others bringing her home. Most recently, she was out overnight, the police bringing her home, and she was quite disheveled. Andrea now dreads leaving her mother to go to work, fearing what might happen to her through the day. Sheryl's also escalating behavioral changes, with episodes of becoming aggressive and physical. Andrea's concerned that her mother is no longer safe living with her, but wants to be sure that there's not a treatable cause of these issues. Last week, she took her mother to Sheryl's longtime primary care physician, Dr. Masood. She underwent several tests, and today they're returning to the PCP's office for follow-up. During the last visit, Dr. Masood conducted a series of blood tests to rule out any reversible causes of dementia, including infection, metabolic or endocrine abnormalities, nutritional deficiencies, and others. The lab tests have all come back normal except for demonstrating some mild dehydration. Together, Sheryl, Andrea, and Dr. Masood decide that the best next step is a referral to a neurologist for further dementia evaluation. While Sheryl and Andrea wait, Dr. Masood's office staff send a referral request to Dr. Carlisle using the 360X via Direct Standard. The lab tests are included in the CCDA that is sent to the neurology office, preventing duplicate testing, thereby decreasing the cost of care and enhancing the care efficiency. Dr. Carlisle's office staff receives the request, review his schedule, but must decline as he does not have any available appointments in the time frame that's been requested. They send a decline message back and purge the documents out of their system. Receipt of the decline message closes the referral loop and terminates this referral ID. Let's see this process in the ECW and Cuvera systems.
Thank you, Dr. Miller. Hi, everyone. My name is Trey Forts. I'm a senior systems integration engineer with eClinicalWorks. What you're seeing on my screen right now is the eClinicalWorks web EMR, and I'm on the progress note for Sheryl. In the office today is her daughter, Andrea, as well. And today I'll be playing the role of Dr. Masood. On the progress note, you'll see that I've documented a chief complaint of dementia, as well as the current medication, which is lisinopril. If I scroll down, you'll see that I've added the assessment of unspecified dementia with behavioral disturbance, as well as essential hypertension. I've also added to the progress note the electronic lab results, which show no known metabolic causes. And I'm now ready to refer Sheryl to a neurology specialist after a brief conversation about today's visit. So if I go ahead and click on the electronic referral from the treatment section, you'll see that opens the electronic referral window, and the from provider, Dr. Masood, automatically populates. The to provider is Dr. Carlisle, who utilizes the Cuvera interface engine, and I found Dr. Carlisle using the Direct Trust directory. The specialty is neurology, and the reason for this referral is further workup, as recent lab tests are negative for known metabolic causes. And I've also added the diagnosis of unspecified dementia with behavioral disturbance, as well as essential hypertension. If we take a quick look at the attachment screen, you'll see that I've attached the CCDA for today's encounter, and I've marked the urgency as urgent for today's priority. I'm going to go ahead and send this referral electronically over to Cuvera by clicking the send referral button in the bottom right-hand corner of the screen, and that generates the electronic 360X referral. Now, when doing so, we generate a unique 360X ID in the background. This allows us to attach the status that we received back from Cuvera to the original electronic referral that was sent out from eClinicalWorks. So now I'll go ahead and pass the screen over to Chuck to demonstrate the Cuvera system.
Thank you, Trey. My name is Chuck Swigel, and I'm with Cuvera. In this scenario, I represent Dr. Carlisle's neurology clinic staff. Our practice receives many of our patients via the referral process. Our reputation as a specialty practice is determined by how we treat our patients and how responsive we are with referrals from other providers to our clinic. We feel that the 360X profile will help us in providing better care for our patients and in being more efficient in responding to referral requests from outside providers. If we accept the referral patient, we will automatically create a new chart for the referred patient using the information in the referral. Sometimes we do need to decline a referral and would prefer not to create a chart for a patient that was not seen. The solution we have implemented allows us to use the features of the 360X protocol to accomplish both goals. In this case, we received a request for an urgent referral from Dr. Masood for Sheryl Jones. Since it is an urgent request, the staff reviews the incoming referral from Dr. Masood and checks the schedule. You'll notice that there's two attachments to the message. There's two attachments to the message. Since we have to decline, that the staff marks it as declined, updates the referral. They recognize that we cannot accommodate the referral request in the time frame requested, so they decline the request. This provides immediate feedback to Dr. Masood, so his staff can schedule with another provider while Sheryl is still in the office. Since the referral is declined, all patient documents are automatically purged, which is important because we never actually met with Sheryl. You can see that the documents that were attached are gone now. Now we'll go back to Dr. Miller for further updates.
In real time, Dr. Massoud's office staff received the decline from Dr. Carlisle's office. His staff immediately sent a new referral request with a new unique referral ID and the CCDA, which had the lab tests, to Dr. Allen, another neurologist. Her staff review her availability and send an accept notification, as she does have an appointment available to see Sheryl. Let's see this in the ECW and Epic systems.
Okay, so now we're back in eClinicalWorks, and this is our electronic referral hub. So this is our centralized workflow for all inbound and outgoing referrals. So now if I click on the electronic status of the referral that was sent to Dr. Carlisle, you'll see that that decline came back again in almost real time. So as a referral coordinator, this lets me know that Dr. Carlisle does not have the bandwidth to see Sheryl today. So I'm going to automatically pivot and send a new referral to Dr. Allen. Now, if I click on this electronic referral, this is essentially a cloned electronic referral. So the front provider is again Dr. Massoud, and the to provider is now Dr. Allen. I found Dr. Allen using the Direct Trust directory as well. The specialty is neurology, and the same reason, diagnosis, and CCDA attachment. So now I'm going to click the send referral button and send that over to Dr. Allen, who utilizes Epic. And I'll pass the screen over to Vasil to demonstrate the Epic system.
Hello, hello everyone. My name is Vasil Pechev. I work for Epic in the interoperability area. And today, right now, I'm playing the role of a referral coordinator at the clinic where Dr. Allen practices. And we can see here that we have a referral that arrived from Dr. Massoud for Dr. Allen. I can do a quick check on Dr. Allen's schedule. And it is amazingly open. Therefore, I will accept that referral. So when I confirm that acceptance, at that point, another notification will go back to Dr. Massoud so that he will know that there's an availability for the patient to be seen. And now, back to Dr. Miller.
There is scheduling notification capability in the 360X standard. However, today we are demoing Argonaut Fire scheduling capabilities in ECW and Epic to emphasize how additional technologies can complement the workflow of the 360X protocol. eClinicalWorks, using the Argonaut Fire scheduling specification, requests an appointment in the Epic system once they've received the accept notification from Dr. Allen's office. The Epic system responds with available appointment times for Dr. Allen. The staff in Dr. Massoud's office select the appointment best suited for the patient and book the appointment in the Epic system. Let's look at this in the ECW system.
Okay, so now we're back in eClinicalWorks on that same referral hub. So now if I click on the electronic status for the referral to Dr. Allen, you'll see that that referral was accepted. So this lets my referral coordinator know that Dr. Allen does have the bandwidth to see Sheryl within the requested time frame. So now I'm going to click on Find Appointment. So this is going to send a real-time FHIR scheduling request over to Epic, and you can see the available appointments come back. Now, because of the urgency of today's referral request, I'm going to pick the first available appointment, and this is going to send a book request over to Epic, and that book the appointment in the Epic system, and you can see that Sheryl has an appointment today at 4:30 with Dr. Allen. So now I'll pass the screen back to Dr. Miller to summarize that workflow.
Once the patient having a same-day appointment with Dr. Allen, the patient checks in, and the staff create a new patient chart using the most up-to-date discrete data received from Dr. Masood's office, including the labs, the problem list, allergies, medications, immunizations. These can be pulled into the chart and greatly reduce provider transcription burden and transcription errors, saving costs of duplicate testing. As the patient is roomed, the data is verified with the patient and her daughter. The patient then has a consultation with the neurologist, Dr. Allen. She arranges for a same-day brain CT scan, which unfortunately demonstrates multi-infarct dementia. The neurologist increases the patient's lisinopril dose from 20 milligrams to 40 milligrams daily and adds the ICD-10 diagnoses for multi-infarct dementia with behavioral disturbance and for wandering. She notes that the patient is not safe in her current living environment and recommends placement in a skilled nursing facility. The neurology staff return the CCDA with the consultation and the CT report to the PCP immediately following the encounter. This report comes with a recommendation for placement in a skilled nursing facility. On receipt of the consult, Dr. Masood's staff reconcile the problem list, allergy, medication, immunization data in the patient's eClinical work chart. The unique referral ID, if this were an interim consultation, would persist until the loop is closed. But as this is the ultimate consult, receipt of this consult closes the referral loop and terminates this unique referral ID. Let's see this in the Epic and ECW systems, starting in Epic with seeing how the appointment scheduled using the Argonaut is displayed in Epic. Passing to Vasil.
So again, here you can see now the newly scheduled appointment. We are already seeing the patient, so I'll go to the encounter and look at my patient. So we'll look at the patient consult. And as we already mentioned, we already received the information from eClinical Works where we not only received the basic demographics and diagnosis, but also we saw some clinical results for this patient. So now, within the consult, I can see the order that I placed as a Dr. Allen, and I can see the impression that there is indeed chronic multi-territory vascular infarctions in the temporal lobes. So what that means, that allows me to look at the current diagnosis, which is the multi-infarct dementia with behavior disturbance that is now part of the patient's record. And once I'm done with the encounter, I can sign the encounter. Signing the encounter closes the visit. And since that is the only visit that is part of this referral, it will send the outcome of the visit. So the reports that you saw and any additional information, the new diagnosis will be sent to Dr. Masood together with a notification that the referral is now closed. And now I'll get the screen back to Trey so that he can show how that shows into the eClinicalWorks system.
Thank you, Vasil. So now we're back in eClinicalWorks, and I'm on the progress note for the follow-up visit with Dr. Masood and Sheryl and her daughter, Andrea. The nice thing about 360X is with that unique 360X ID, the outcome, the consultation note, automatically attaches to Sheryl's chart. So you can see from the right chart panel under the DRTLA tab, I now have a new CCDA link. So if I click on that link, that opens a pop-up window where I see any updated problems and medications and allergies, that PAMI data. If I click on this blue arrow, this is going to automatically import the updated problem onto the progress note. And if I scroll down to the assessment section, you'll see that that updated progress, vascular dementia with behavioral disturbance, is now added to my progress note. So now I'll pass the screen back to Dr. Miller to summarize the reconciliation workflow.
It's now Dr. Masood's responsibility to break the news to Sheryl and Andrea that indeed there is no reversible cause for the dementia, and that the recommendation must be that she should not live with her daughter any longer. He discusses the results and recommendations with Sheryl and Andrea, and Sheryl recognizes that she's no longer safe in Andrea's home and requires additional care. Together, they decide on skilled nursing facility placement. Dr. Masood's office, using 360X via direct long-term post-acute care functionality, sends referral requests for the patient to 2 skilled nursing facilities. These requests include the CCDA with all of the most recent patient information, and they also send a patient review instrument, or PRI, as a PDF. This will enable the skilled nursing facilities to be aware of all of Sheryl's issues and understand if they have the staffing and a bed to accept the patient. Let's see this workflow in the ECW system.
Okay, so now we're back in eClinicalWorks on that centralized referral hub. So now Dr. Masood has queued up 2 new referrals to the skilled nursing facilities, and the referral coordinator sees those new referral requests. So the first one we see is for Better Failing Care, which is the preferred skilled nursing facility for Sheryl based on the proximity of that facility to her daughter, Andrea. So we're going to click on that electronic referral, and we can see that again. The from provider is Dr. Masood. The to provider is Better Failing Care, which I found using the Direct Trust directory. The reason is the skilled nursing admission request, and the diagnosis is the essential hypertension and the updated diagnosis of vascular dementia. If I click on the attachments tab, you'll see that I've attached the CCDA as well as the completed PRI and the consultation note that we received back from Epic. So now I'm ready to go ahead and send that electronic referral. In addition to sending that electronic referral, we also have a referral request to Good Health Center as a backup request. This is essentially a cloned referral, so everything is going to be the same. The from provider is Dr. Masood. The to provider is Good Health Center, who I found using the Direct Trust directory. Same reason as admission request, same diagnosis, and same attachments, completed PRI and consult note from Epic. So now I'm going to send that referral electronically as well, and I'll pass the screen back to Dr. Miller to summarize that workflow.
So the two request patient transfers have been sent to the two skilled nursing facilities. The skilled nursing facilities received the request, both carefully reviewed the CCDA and PRI and all of the patient information. Both have a bed available and are able to take care of Sheryl in their skilled nursing facilities, so they both accept the patient and send an accept notification back to Dr. Masood's office using 360X protocol. Let's see this process in the Matrix Care and No2 systems. So I'm sending it to Amy, who is with Matrix Care.
Hi, my name is Amy Freeman. I'm with Matrix Care, and I'm going to play the role of an admission coordinator for Better Feeling Care. So we're in the Matrix Care intake product, and you can see that we have received that message from Dr. Masood. We have Sheryl Jones here. We see it came via direct from Peter Masood. And what I can do now is take a look at what I did in fact receive. So we were able to parse her demographic information that we received. And then we are also able to look at that PRI and a summary of care that we also received. We also parsed some additional information from the CCD that we received, such as medications, and then we're able to perform an assessment and so forth to determine if we are, in fact, interested in taking Sheryl Jones. After performing all that, it appears that we are. So you can see that we are now awaiting approval, but because we have sent a message back to Dr. Masood to let him know that we are interested. Okay, now I'll hand it over to Alan with No2.
Thanks, Amy. Hi, everyone. I'm Alan Swenson with No2, and I'm playing the role of an admission coordinator for another skilled nursing facility. Good Health Center does not have an EMR system. We maintain all of our patient records on paper, but through the No2 web portal, I'm able to engage with other providers in my community with both direct messaging, including 360X, and also query-based record exchange through Care Equality. In my No2 intake, I can see all referral messages that have been received and are still waiting to be processed. And that message for Sheryl from Dr. Masood is here at the top of my list. Selecting that message, I can see demographic information about Sheryl that was extracted from eClinicalWorks CCDA document, and I have a couple of different views into that document. Here I can see some details about the referral, as well as Sheryl's current allergies, medication, problem list, and any other clinical information provided by Dr. Masood. I also have access to a PDF of that PRI form that was sent across with the CDA. And based on review of this information, we do have a room available for Sheryl. So I will go ahead and accept that referral, triggering that response back to eClinicalWorks. And now back over to Dr. Miller.
Alan, can you there. So now both skilled nursing facilities have accepted the request. And Dr. Masood reviews the key skilled nursing facility performance data for the two skilled nursing facilities with Sheryl and Andrea. One of the reasons they select Better Feeling Care is that the key skilled nursing facility performance data is very good, but also because it's very close to Andrea's house, enabling her to visit her mother regularly. Dr. Masood's office then sends a confirmed skilled nursing facility selection message to the Better Feeling Care which the patient has selected. Immediately thereafter, the office staff sends a message of discontinue request to the not selected skilled nursing facility. Let's see these messages in the ECW system.
Thank you, Dr. Miller. So now we're back in eClinicalWorks on that same electronic referral hub. So now if I click on the electronic status for the referral that was sent to Better Feeling Care, we'll see that that referral was accepted. So that's great news because this is the preferred facility for Sheryl. So we'll go ahead and click confirm, and that's going to send a confirmation notification via 360X over to Better Feeling Care. Now, in addition to that, we had the referral request that was sent to Good Health Center. We're going to click on the referral status, and we'll see that that referral request was also accepted. However, we're not going to be sending Sheryl to that facility today, so we're going to click discontinue, and this sends a discontinue notification over to the Good Health Center. So now I'll pass the screen back to Dr. Miller to summarize that workflow.
Sheryl is admitted the same day at her selected skilled nursing facility. Here, she's safe, happy, and gets the daily care and attention she requires. At patient admission, the skilled nursing facility are able to create a new patient chart with the discrete data from the CCDA received from Dr. Masood. Again, this can flow into the existing chart and eliminate transcription errors as well as decrease the burden of documentation. The skilled nursing facility sends the PCP an admit notification. This admit notification closes the referral loop. Let's see this in the ECW system.
Okay, so now we're back in eClinicalWorks one last time. I'm going to again click on that electronic referral status, and you'll see that admission notification came back from Matrix Care. So this essentially closes the loop and completes the series of encounters between Dr. Masood, Sheryl, and her daughter Andrea. And I'll pass the screen back to Dr. Miller to start to wrap up the presentation.
Pushed essential information in real time during care transitions decreases provider burden and cost, enhancing the quality and efficiency of care, as well as patient, caregiver, provider, and staff satisfaction. Referral management has long been a time-consuming and frustrating process. 360X allows for transparency of the progress of transitions of care throughout the entire process.